Kidney stones are a common and often excruciatingly painful condition that affects millions of people worldwide. They are formed when minerals and other substances in the urine crystallize and stick together, causing a blockage in the urinary tract. If left untreated, kidney stones can lead to serious complications such as kidney damage, infections, and even kidney failure. Unfortunately, many people may not recognize the symptoms of kidney stones until they experience severe pain or complications. This is why it's crucial to be aware of the signs and symptoms of kidney stones, so you can seek medical attention promptly and receive the appropriate treatment. In this video, we will explore the common symptoms of kidney stones, risk factors, and treatment options. Whether you've experienced kidney stones before or are simply interested in learning more about this common condition, this topic is sure to be informative and useful for anyone. So let's dive in. What are kidney stones? Kidney stones are hard, pebble-like mineral deposits that form in the kidneys or urinary tract. They can range in size from a grain of sand to a golf ball, and can be extremely painful when they pass through the urinary tract. Kidney stones form when there are high levels of certain minerals and salts in the urine, such as calcium, oxalate, and uric acid. These substances can stick together and form crystals, which can then grow larger and form a stone. Other factors that can contribute to the formation of kidney stones include dehydration, family history of kidney stones, certain medical conditions, and certain medications. Symptoms of kidney stones. The symptoms of kidney stones can vary depending on the size and location of the stone. Some people may experience no symptoms at all, while others may experience severe pain and discomfort. Here are some of the most common symptoms of kidney stones. Number 1. Pain. Pain is the most common symptom of kidney stones. The pain can be intense and may come and go in waves. It is usually located in the back or side, but can also radiate to the lower abdomen and groin. The pain may be accompanied by nausea, vomiting, and sweating. Number 2. Blood in urine. Another symptom of kidney stones is blood in the urine. The urine may appear pink, red, or brown in color. This is caused by the stone scraping against the walls of the urinary tract and causing small amounts of bleeding. Number 3. Frequent urination. Kidney stones can cause frequent urination, as the stone can irritate the bladder and cause a feeling of urgency. However, some people may also experience difficulty urinating or a weak urine stream. Number 4. Painful urination. Painful urination can also be a symptom of kidney stones. The pain may be burning or stinging, and may be accompanied by a frequent need to urinate. Number 5. Fever and chills. In some cases, kidney stones can cause a fever and chills. This is a sign of infection and requires immediate medical attention. Number 6. Nausea and vomiting. Kidney stones can cause nausea and vomiting, especially if the pain is severe. This is because the body is trying to cope with the pain and may react by causing nausea and vomiting. Number 7. Cloudy or foul-smelling urine. Kidney stones can also cause cloudy or foul-smelling urine. This is caused by the presence of bacteria or pus in the urine, which can be a sign of infection. Causes of kidney stones. Kidney stones are caused by a buildup of certain substances in the urine. These substances can form crystals, which can then clump together and form stones. Here are some of the most common causes of kidney stones. Number 1. Dehydration. Dehydration is one of the most common causes of kidney stones. When the body is dehydrated, the urine becomes more concentrated, which can lead to the formation of crystals. Number 2. High levels of calcium. High levels of calcium in the urine can also lead to the formation of kidney stones. This can be caused by certain medical conditions or by consuming too much calcium in the diet. Number 3. Urinary tract infections. Urinary tract infections can also cause kidney stones. This is because the bacteria that cause the infection can lead to the formation of crystals in the urine. Number 4. Certain medical conditions. Certain medical conditions can also increase the risk of developing kidney stones. These include gout, hyperparathyroidism, and inflammatory bowel disease. Treatment options for kidney stones. The treatment options for kidney stones depend on the size and location of the stone. Here are some of the most common treatment options. Number 1. Drink plenty of water. Drinking plenty of water is one of the most effective ways to treat and prevent kidney stones. This helps to flush out the kidneys and prevent the formation of crystals. Number 2. Pain medication. Pain medication can be prescribed to help manage the pain caused by kidney stones. Nonsteroidal anti-inflammatory drugs, NSA drugs, such as ibuprofen and acetaminophen are commonly used to relieve pain. For severe pain, stronger prescription pain medications may be necessary. Number 3. Medications to break up stones. In some cases, medication may be prescribed to help break up the kidney stone. These medications work by dissolving the stone or by preventing it from growing larger. However, they may take several weeks or months to work, and are not effective for all types of kidney stones. Number 4. Extracorporeal shock wave lithotripsy, ESWL. ESWL is a non-invasive procedure that uses shock waves to break up kidney stones. The shock waves are directed at the stone from outside the body, and the stone is broken up into smaller pieces that can be passed more easily. ESWL is generally used for stones that are smaller than 2 centimeters in diameter. Number 5. Ureteroscopy. Ureteroscopy is a minimally invasive procedure that involves inserting a small scope into the ureter to remove the stone. This is typically used for stones that are too large to pass on their own or for stones that are located in the lower part of the urinary tract. Number 6. Percutaneous nephrolithotomy. Percutaneous nephrolithotomy is a surgical procedure that involves making a small incision in the back and using a scope to remove the kidney stone. This procedure is typically used for larger stones that cannot be treated with other methods. Preventing kidney stones. There are several steps you can take to help prevent kidney stones from forming. Number 1. Drink plenty of water. Drinking enough water helps to flush out the kidneys and prevent the formation of crystals. Number 2. Reduce your intake of animal protein. Consuming too much animal protein can increase the levels of uric acid in the urine, which can lead to the formation of stones. Number 3. Reduce your salt intake. High levels of salt in the diet can increase the amount of calcium in the urine, which can lead to the formation of stones. Number 4. Limit your intake of oxalate-rich foods. Oxalate is a substance found in many foods, including spinach, rhubarb, and chocolate. Consuming too much oxalate can increase the risk of developing kidney stones. Number 5. Take certain medications as directed. If you have a medical condition that increases the risk of kidney stones, such as hyperparathyroidism, your doctor may prescribe medication to help prevent their formation. Well, that's a wrap on our kidney stone symptoms video. We hope you found this information helpful and informative. Remember, if you're experiencing any of these symptoms, don't hesitate to see a doctor. With early diagnosis and treatment, you can prevent complications and get back to feeling your best. If you enjoyed this video, be sure to hit that like button and subscribe to our channel for more exciting and informative content. And as always, thanks for watching.